In your work related to vaccines, how many fetuses have been part of that work?
My own personal work, 2.
2. So in all of your work related to vaccines throughout your whole career, you've only ever worked with 2 fetuses?
In terms of making vaccines, yes. Yes.
I'm going to hand you what's been marked Plaintiff's Exhibit 41. Okay? Are you familiar with this article, Dr. Plotkin?
Yes.
Okay. Are you listed as an author on this article?
Yes.
Okay. This study took place at the Wistar Institute, correct?
Yes.
You were at the Wistar Institute, correct?
Yes.
How many fetuses were used in the study described in this article?
Quite a few, but my answer to the previous question was, what did I use to make vaccines? And the answer was 2.
Can you read back the question I had asked?
Just now?
No, prior.
In your work related to vaccines, how many fetuses have been part of that work? Answer: my own personal work, 2.
Okay. So I'm going to ask that question again. In your work related to vaccines, how many fetuses were involved in that work?
There were only 2 fetuses involved in making vaccines. When fetal strains, fibroblast strains, were first developed, I was involved in that work trying to characterize those cells, but they were not used to make vaccines.
Wasn't the purpose of this study to help develop a human cell line or to support the use of human cell lines in the creation of vaccines?
The idea was to study the cell strains from fetuses to determine whether or not they could be used to make vaccines.
Okay. So this was related to your work?
Well, yes, in a sense,
to
yes.
Vaccines, correct?
Yes. It was preparatory.
Okay. So this study involved 74 fetuses, correct?
I don't remember exactly how many.
Turn to page 12 of the study.
Yeah, 76.
76.
Mm-hmm.
And these fetuses were all 3 months or older when aborted, correct?
Yes.
Okay. And these were all normally developed fetuses, correct?
Yes.
Okay. These included fetuses that were aborted for social and psychiatric reasons, correct?
Correct.
Okay. What organs did you harvest from these fetuses?
Well, I didn't personally harvest any, but a whole range of tissues were harvested by co-workers.
Okay. And these pieces were then cut up into little pieces, right?
Yes.
And they were cultured?
Yes.
Okay. Some of the pieces of the fetuses were pituitary gland that were chopped up into pieces to okay, included the lung of the fetuses?
Yes.
Okay, included the skin?
Yes.
Kidney?
Yes.
Spleen?
Yes.
Heart?
Yes.
And tongue?
I don't recall, but yeah, probably yes.
So I just want to make sure I understand. In your entire career, and this was just one study, so I'm going to ask you again. In your entire career, how many fetuses have you worked with?
Well, I don't remember the exact number, but quite a few when we were studying them originally, before we decided to use them to make vaccines.
Do you have any sense? I mean, this one study had 76. How many other studies did you have that you used aborted fetuses for?
Oh, I don't remember how many.
You're aware? Are you aware that one of the objections to vaccination by the plaintiff in this case is the inclusion of aborted fetal tissue in the development of vaccines, and the fact that it's actually part of the ingredients of vaccines?
Yeah, I'm aware of those objections. The Catholic Church has actually issued a document on that which says that individuals who need the vaccine should receive the vaccines regardless of the fact, and that I think it implies that I am the individual who will go to hell because of the use of aborted tissues, which I am glad to do.
Okay. Do you know if the mother is Catholic?
I have no idea.
Okay.
But she should consult her priest.
If she has if she's in fact Christian, I guess, right? In any event, so we got 76 in this study. Would you approximate it's been a few hundred fetuses?
Oh no, I don't think it was that many.
Okay.
It was probably not many more than in this paper.
Uh-huh.
And I should stipulate that we had nothing to do with the cause of the abortion.
Mm-hmm. Some of these were for psychiatric institutions, correct?
Actually, all I can say is that the fetuses that I personally worked with actually came from Sweden, from a Swedish co-worker. And so I, in no case, was able to determine what exactly the reason for the abortion was.
I'm just asking you, some of the fetuses that you did use did come from abortions from people who were in psychiatric institutions, correct?
I don't know that. What I'm telling you is that I got them from a co-worker, and if it's stated in the paper, it's true, but otherwise I do not know.
Okay, so if it's in the paper, you don't contest it, right?
I don't contest it, no.
Okay. Have you ever used orphans to study an experimental vaccine?
Yes.
Have you ever used the mentally handicapped to study an experimental vaccine?
I don't recollect ever doing studies in mentally handicapped individuals. At the time, in the 1960s, it was not an uncommon practice.
So, you're saying, I'm not clear on your answer, I'm sorry. Have you ever used the mentally handicapped to study an experimental vaccine?
What I'm saying is I don't recall